So first of all, PGT A is a genetic test performed on embryos that has been produced through an IVF cycle. PGT A detects abnormalities in the number of chromosomes in the embryos, also known as aneuploidies. Chromosomes are very important for healthy growth and development. Embryos with the incorrect number of chromosomes typically do not result in a successful pregnancy or may lead to a birth of a child with a genetic condition. So PGT A identifies embryos with the correct number of chromosomes so our team can select the best embryo with the best chance of success in an IVF cycle. For making a PGT A, first we need to create the embryos through an IVF cycle, as I said before. When these embryos are created, we have the embryonic development until day 3 or day 5 of culture, always depending on the case. Once we decide how long we're going to leave the embryos in culture, we have the embryo biopsy. Here, a few cells are removed carefully from the embryo, from the part of the embryo that will form the placenta. Samples are sent to the genetic laboratory while the embryos remain safe in culture, or in some cases, we can freeze them. In the genetic laboratory, they have all the technologies to analyze the genetic material present in every embryo. And we can obtain the results only in 24 hours if you want to do a fresh embryo transfer. If not, then the results can last until 1 week. The embryos that we are going to transfer are always the ones that have no abnormalities, because these are the ones that have more chance to success in a pregnancy. If we have more than 1 or 2 embryos that have no abnormalities or aneuploidies, we can freeze these embryos for future use. Many people wonder if PGT A is a trustful test. Well, the accuracy of PGT A is around 98%. So with this data, we can confirm that the results of this test are really reliable. Another doubt that is very common in our patients is if the biopsy can damage the embryos. As any manipulation process, a possible risk damage cannot be completely denied. But if the biopsy is performed by an expert and if the embryos have a good quality, there should be no risk at all. Also, several studies have shown that embryo biopsy does not affect to embryonic development and subsequent implantation. So PGT A will always be recommended in our clinic, always, as long as there is a medical prescription.